a man who knows a huge amount about marketing MedTech. David Olsen from MedTech Bridge. Tell us something about your tailored approach to MedTech from Minneapolis.
Thank you, Mark. Yes, the MedTech Bridge originally was a grant-funded program from the Danish Technical University. We have since spun that out, and now we have a bridge from Scandinavia primarily, but certainly the UK and the rest of Europe. And we focus on bringing MedTech firms to the Twin Cities primarily. We'll go other places too, but we really think the Twin Cities of Minneapolis and St. Paul are a special place for a MedTech firm. We take a tailored approach that's based on whatever the gaps are initially. We know that for most early stage firms, money's tight, and so we can't reinvent the wheel. They can't afford to reinvent the wheel. They really have to start with where are the gaps and how can we move forward. So we take a tailored approach early on. Very often we're looking at market fit solutions. We provide comprehensive support for conducting customized market assessments and tailor-made fact-finding missions, getting the customer feedback, even potential in-person visits. All of this comes in to help us to get a deeper understanding of how you're going to fit in the US market and help you and your investors to judge your likelihood of success. We have a network of over 300 senior advisors around the country. Many of them are in specialty. I think we have most of the life science specialties covered. And we use these mentors to help add a more nuanced and thoughtful understanding of what you'll need to do to be successful in the market. Everyone in life science wants to come into the United States and become the standard of care, and it's possible, but you do need to have the right people with the right experiences. We help with investor and regulatory support, and we help with knowledge sharing and soft landing facilitation. In particular, I think we get taken up most on our on-demand mentoring. Tim and I sit down to most calls together, and we offer, I think, some good grounding guidance on what steps need to be taken. We certainly have a network of legal and regulatory support as well. Some of these people are on our call today, but Mark?
Thanks. That's great, Dave. And if we were to, just as a sort of final thought, you're really quite unique in the process because you cover so many bases, don't you? Just purely within MedTech.
We do. We prioritize a tailored strategy for each client, and we focus on their specific needs and really focus on their budget constraints rather than offering a one-size-fits-all solution.
Dave, thank you for that. And for Tim lurking in the background, really interesting and insightful.